Dr. Kieran Moore. I'm the Medical Director for the Acute Care Enhanced Surveillance System. This is a partnership between 157 different hospitals across Ontario, the Ministry of Health, and KFLA Public Health. The ACES system receives information electronically from all of our partner hospitals in real time through a secure private network and gets sent here to KFLNA, where it's stored, analyzed, and then made available to the public and to epidemiologists and health system partners so they can be provided with situational awareness regarding the health system. The benefit of our system is that it is in near real time. The data that we're presenting to you on the pandemic tracker, though, is aggregated and updated on a daily basis at midnight. So that it does give a good picture of activity on a daily basis across Ontario for the data that we're providing. Our goal is to give the public and decision makers information that they have at their fingertips on a daily basis to enable them to understand how COVID-19 could be spreading into the community and back into the hospital sector. It is not positive tested patients yet. It is the diagnosis made at the time of admission. So it's important to realize it's a proxy. We will be modifying and updating the system as we need to ensure that it's a reasonable and reliable proxy to tested positive patients. So page 1 of the Acute Care Enhanced Surveillance Pandemic Tracker has important components to it. It includes the diagnosis at the time of admission to hospitals of pneumonia, asthma, influenza-like illness, sepsis, and where it's coded that the patient has been admitted because of COVID-19, these are all grouped together and presented to be able to monitor in real time any admissions for that group of illnesses. So this is a very sensitive indicator because it includes where COVID-19 has been included as the cause for the admission. We've created a moving average of what should be expected, and that's the teal colored line, which now is showing a 7-day moving average over the last month. This is calculated by looking at the last 2 years of activity across Ontario. The black line is the current level of activity across Ontario for all hospitals. And you can see just recently there's been an uptick in admissions fine. The yellow line is a historic moving average of 1 standard deviation away from the 7-day moving average. The purple line would be 2 standard deviations away from the moving average. So there is concern when you see that rise of this group of syndrome because COVID-19 causes pneumonia, can make an exacerbation of someone's asthma, can present like influenza with fever and chills and increasing cough, and or present with sepsis. So this is an area of concern, and then you can look at the mapping component of our tool to see that in the Erie-St. Clair district, and all of these geographic boundaries are what the LHIN boundaries have been across Ontario. And you can also see that the Toronto area has increased from baseline of what's expected for this group of illnesses, which can be an indication of increased activity of COVID-19 in those areas. So the color coding is here, and it's called a level 2 when it turns yellow from its baseline color of green, and then can move to purple as the third marker. On this interface, you can pick the area of the province in where you live. So we could break it down just to look at Southeast. So that Southeast LHIN is the area in and around Kingston. So we will get rid of the Select All button. We'll just move to Southeast. And then the epidemic curve for activity from our region will be shown. So it's good to see that the black line is below our 7-day moving average for our region. You can also, given that we're just looking at a 7-day moving average, look at a 30-day moving average, and that often will present with a less erratic baseline. So our 30-day moving average, we're somewhat above the 30-day trend, and that's again something we'd like to keep an eye on across our region. And for the same mapping areas of all of the local health integration networks across Ontario, you can see if there's any activity in any particular region of the province by zooming in or zooming out through the mapping tool.